I'm Jeannie Gaines, and I'm here with the Alabama Department of Public Health Comprehensive Cancer Control Program. I'm joined today by Dr. Gabrielle Rocque from the University of Alabama at Birmingham. Good morning, Dr. Rocque.
Good morning. Thank you for having me.
You're welcome. So tell us a little bit about your role at UAB.
So I'm an assistant professor in the Division of Hematology and Oncology at UAB, and I'm also the medical director for the UAB Health System Cancer Community Network.
Okay, so today we're talking about metastatic disease. Tell us a little bit about what that means.
So metastatic disease means that a patient has had a cancer that has started in one place in their body. An example of that would be a breast cancer that has spread to somewhere else in their body beyond the lymph nodes. And that's usually a bone, lung, liver, brain, or some other distant place. And there's a couple of things that are important to understand about that. One question I get often is, is this bone cancer, because it's now in the bone? But it's really not. It's really the same cancer as where the cancer started. So if we look under a microscope, we would see the same type of cells wherever the cancer has gone to throughout the body. The other thing that's important to note about metastatic cancer is that in most cases, that is considered to be not curable. And what that means is that we don't have treatments right now that are going to make the cancer go away and stay away forever. So in most cases, we're looking at treatment that is going to be ongoing for the life of that patient.
Okay. When a person's told they have a metastatic disease, what are some concerns that they'll want to talk to their doctor about?
So I think first is really important for patients to have a really good understanding of what is the purpose of treatment. So I mentioned that some metastatic cancers are incurable. In fact, most of them are. And so the goals of treatment in that setting are two important goals. First is to help the patient live longer, and second is to help the patient live better. And those are equally important. So in making decisions, it's going to be critical to think about what are the side effects? How is the patient going to feel when they're on treatment? How is it going to impact the things that are important to them in their daily life?
How would you suggest that a patient bring up to their family and friends that they have this diagnosis?
This can be really challenging for patients. And so typically what I recommend is they initially start with those people that are really close to them, that are going to be their support system. So they're the people that are helpful and not going to burden them or cause more stress in their life by having that conversation. And then once the patient has talked to their close circle of friends and family, I suggest that they identify a point person, somebody that can help them share information with other family and friends and get those questions, because it can be very overwhelming for patients to get all kinds of questions from people within their family and friend circle, and even sometimes the community at large. And I also find that patients will often hear advice from all kinds of people that they know. And I think if you have a point person, that helps to limit the unhelpful advice that just causes more stress for the patient and makes that patient journey better.
Right. What about patients who want to continue working?
So that's a great question, and one that we've been talking a lot about recently in our community. And for patients that are still working, I think the first question to ask is, do they like working? Is that something that they find is valuable to them? I have a lot of patients who feel that their work life is really a part of who they are as a person. And we really want to maintain that for as long as possible. And so that's an opportunity for the patient to ask their physician for letters to explain, what they are capable of doing. And I think being very clear with their employers about what their needs are. So the patient's going to have to talk to their employer and be honest about what they're going through and be able to ask for the time to get the health care that they need, but also the flexibility if they're having trouble, they're having fatigue from their treatments, to be able to take a short rest break or maybe even change the activities that they're doing so that they can be a successful member of the work team. And that is a key important thing for many people. So I think if we can encourage that and be flexible as healthcare providers and as employers and as patients to say, these are the things that I need, that can be very valuable.
Absolutely. Well, what would you say are some resources that can help patients cope and manage their metastatic disease?
So in terms of the working, which we had just talked about, there is the Alabama Department of Rehabilitation Services, and there are several other different groups that can be helpful in terms of patients knowing what are their rights, how to talk to their employers, and really how to make that a successful experience. In terms of some of the more kind of social support group type resources that are national resources, there is an organization called metacancer.org, which can help connect patients with metastatic cancers with other patients to help them identify people that are having similar experiences, because this is a very stressful diagnosis for people, and that sense of community is really important, even beyond their family and friends that sort of are in their local community. Also, the UAB Comprehensive Cancer Center, website has information about how to understand disease, how to connect with other patients, and I think can be a very valuable resource.
Sure. You mentioned the importance of controlling breast cancer as long as possible. What does this mean for treatment?
So in terms of treatment for metastatic cancers in general, as I said, this is a long journey for patients, but it's really exciting because there are a lot of new treatments for several different cancer types that are coming on the market right now. And it's important for patients to be aware of what's out there in terms of new treatments and to ask questions. So one of the things that I encourage my patients to do is to write down their questions in between visits, because sometimes when they get into the office, they forget what are all the things that they wanted to talk about. And along those lines, when they're writing down their questions, read, and look at, what are things like the American Cancer Society and other reputable resources that are talking about what are the new developments in whatever the cancer type is that they're experiencing. And I think the more patients are educated, the better able they are to ask those questions to their doctor and really participate in decision making and make what is hopefully the right decision for them and their values.
How would you tell patients to find out about these new treatments and clinical trials?
Yeah, so there are several different resources. I mentioned the American Cancer Society, which has a lot of great information on their website. Another website in terms of clinical trials specifically is clinicaltrials.gov, and that identifies what are the trials and where they are and what types of patients are in them. It can be a little hard sometimes to navigate because there's a lot of information there, but it'll give patients a place to start and a place to learn what questions, might they ask. Are there treatments that might make sense for them? I also strongly encourage patients, including my own patients, to not be afraid to get second opinions. And getting a second opinion doesn't mean that they don't trust their doctor, but really I think it is feeling comfortable with the treatment that you're getting. And oftentimes that second opinion just reinforces the first treatment or the first recommendation that they had. But I think having that conversation and, from my own experience, I don't get offended when somebody wants a second opinion. And I think patients worry about that a lot, that their doctor will be upset. But that's a really important part of the process, and I think something that we probably need to encourage more.
What would you say is the most important points for a patient living with metastatic disease to take to their doctor?
I think probably the most important thing to do first, after they have sort of adjusted to the idea of having a metastatic cancer diagnosis, is to really spend some time reflecting and thinking about their own values and what's important to them. And I think if you as a patient can come into the office having some clarity about what do you want to do with your time, however long that is, and what's important. Is it important to you to spend time with grandchildren? Is it important to you to travel to a specific place? Is it important to you to try to get your daughter's wedding, whatever it is that is meaningful in your life, to have that as an anchor. Because if you know where your own values are, it's easier to have a conversation about trying to find a treatment that aligns with those values. And I really encourage patients to engage in what we call shared decision making, which means that the clinician, the physician comes to that appointment with a lot of knowledge about treatments and about the disease, and the patient comes with their values. And together they can make a decision about what is the right thing for that patient based on the best evidence in terms of research as well as the patient's goals.
Great. Well, Dr. Rocque, that was some wonderful information, and we truly appreciate you coming out and sharing with us today.
Thank you for having me.
Thank you. And thank you for joining us.